Hi, everybody. Welcome to Insights and Ideas in the Role of Animal Assisted Interventions, AAI, in Speech Therapy. And before we begin, let's cover some disclosures. Regarding financial disclosures, in addition to receiving an honorarium for this podcast, Charlotte, our guest, receives royalties for her book, Pause for Progress, integrating animal assisted interventions into your speech language pathology practice. Press, ASHA Press 2024, so it's brand new. And she receives income from her online course at speechdogs.com. And I love this name. Talk to the Paw, Foundations for Therapy Animal Inclusion in a Professional Setting. Personally, I too receive an honorarium for this podcast. I'm a regular seminar presenter for speechtherapypd.com, and I own Speech Dynamics Inc. Neither of us have any non-financial disclosures. So, okay, all right. So I'm so glad that all of you are here for our live SpeechLink podcast, sponsored, of course, by speechtherapypd.com. I'm Char Boshart, your speech language pathologist host. Sharlet Lee Jensen, MS, SLP, C-AAIS, graduated in 2003 from the University of Washington with a master's degree in speech and hearing sciences. She began her career at a nonprofit early intervention center where she worked with families from a variety of cultures. And she was part of an interdisciplinary team of therapists where she developed a holistic view of child development. She's also worked in the schools and a private clinic and is an independent autism consultant. In 2011, Charlotte started her own private practice, Arlington Speech and Reading, where she specializes with children with autism, childhood apraxia of speech, orofacial myofunctional disorders, articulation disorders, emotional and behavioral disorders, and dyslexia. Her latest passion is incorporating animal-assisted therapy into her therapy sessions. In addition, she and her husband live in Washington State and have a small menagerie of animals. I can only imagine. I love it. So welcome to the Speech Link, Charlotte.
Thank you so much, Char. I'm so excited to be here because this is an area that a lot of speech language pathologists don't know is an option. And I know I was certainly given a lot of misinformation early in my career that it wasn't something that we can do, that it's just for mental health professionals or occupational therapists. But I've really found it's just been a game changer for my practice.
Mm-hmm. Great, great. Well, I have to tell you, that is something that, I've never read much about, or I've never attended a therapy, anything on how to do therapy with an animal present or what to do or what not to do. But you contacted me and I certainly appreciate it. And I thought, wow, that just might be something that's really beneficial for people. And when I asked you about therapists using dogs in schools, tell me what you said. Let's just start off there and then we'll come
Okay.
back to our
Yeah.
original question. But that, I think that's an important thing, because I think my first thought was, oh, I could never do it if I was a therapist in the schools. But you said, yeah, that's
Yeah.
changing.
So I actually have an article on my website in which I interviewed 3 other speech therapists that work in elementary schools, as well as one social worker who works in a high school with kids on IEPs. And they all incorporate therapy dogs into their practice. And so they gave me some really great insights. I have worked for just 1 year in schools. It wasn't a good setting for me personally, and that's why I do the private practice now. But I knew just enough to know that, speech therapists tend to kind of be the redheaded stepchild where they get, little tiny space to work in and they're expected to see these big groups. And so hearing what strategies they put into place in order to make it a successful and accommodating place to incorporate a therapy dog was really interesting. And they definitely had a wide range of experiences. I know one of them, their school district already had an animal assisted therapy program in place. And so they did all their training within district and evaluating the dogs and handlers, the dogs and therapists, for their suitability for the role and things like that. And then others needed to really advocate. One had been working for a couple of years with her school district to help them understand, how they can mitigate the risks involved and what benefits it can bring. And that it's not just that you want to bring your pet to work, it's that there's actual benefits that can really be achieved through that.
Yes, yes, and I hope that we can get into all of that so that we can
Absolutely.
look at the benefits and how you actually get started with a therapy dog and in whatever setting you're working with and how you train them and all of that. I mean, I hope that we can get into that kind of detail to begin. However, let's just start with you and
Okay.
why and how did you come to the decision to incorporate your dog into therapy?
Yeah, so it's something that had always been in the back of my mind since I started practice. But again, I'd gotten kind of misinformation that it wasn't for our field. I had a boss who was an occupational therapist herself by training, and she was like, "Oh no, that's not something speech therapists do." So I'd never really pursued it. But I do work quite a bit with kids that have those what we call EBD, the emotional and behavioral disorders. It's not always the best term for it, but a lot of anxiety-based challenges that may kind of result in them being, aggressive or acting out and having difficulty regulating their bodies. And I had one in particular that I had been working with for several months, and he was kindergarten age and just was not able to develop a rapport. He very much fit that that pathological demand avoidance, or which is also known as a pervasive drive for autonomy now, that PDA profile, where almost anything you asked him to do, he was going to find a reason not to do it. And if you pushed at all, he was going to push back and get out of control in his body pretty quickly. And
Wow.
unfortunately, this child had been, in mom's words, fired from several other therapies and from some after school tutoring and martial arts. It was a family that had really been trying to do everything they could and were really passionate about getting help for their son and just had not found it. So it wasn't like I could bring myself to say, "Oh, I'm sorry, this isn't working out. You need to find someplace else." I was pretty desperate to find some way to connect with this child. And his needs in terms of communication were pretty minor, some articulation and some reading delays, but I couldn't get him to do the work. And so I knew he loved dogs and they had dogs at home. And I thought I had Delta. I'd been working with her for about a year after we adopted her. And I thought, well, let's just try it. So I arranged with the family. He knew that she was going to be there. And he came through the door that day and saw her. And it was literally the first time I'd seen him smile. He was just beaming, chatting. We didn't do a lot of like direct goal directed work that day, that first day at least. But she sat with her head on his lap and he was talking about how cute she was and petting her. And just, it was like the first true conversation I'd been able to have with this child. And just through that, over time, developed that positive association to where he started wanting to come to speech therapy.
Ah, oh,
And I worked with
wow.
him for another 4 years. He was never, an easy child. I always had to stay on my toes and come up with, ways to engage him. But, once I brought Delta once, then I was hooked. I was like, not only for this kid, but over time, over the next few months, I gradually increased the amount of time I brought her along and saw how much other kids too, whether or not they were resistant learners or whether they, were just a little bit anxious and needed some help calming down and persisting with things. It just made a huge difference.
Wow. I love that. And is that Delta behind you?
This is, yes. So Delta is right
Yes.
behind me. We've been working, we saw 5 kids earlier today. And so she's probably
Yes.
just going to fall asleep back there. I've also
I
since
love it.
worked with 3 other therapy dogs too. So just a few months after I started bringing Delta, we had the COVID shutdowns. I had been working with my 8-year-old Brittany Spaniel, Johnny Utah, towards doing this because I became so passionate about it so quickly. And with the COVID shutdowns and only seeing a few kids, he wasn't quite as far in his training as I had planned to, but I kind of threw him into it because we weren't seeing very many kids in person at that point. And he just thrived in it. And I learned so much from him. Delta tends to be a fairly calm dog. She's, a very empathic dog where she knows like if the kids need her to come over, she'll come over and she'll rest her head against them, or she's part Great Dane and they love to lean against things. So she'll lean against the kids and provide that input. Whereas Johnny Utah was very high energy, very wiggly. But I found how helpful he could be for alerting those kids that came in and were kind of sleepy or just difficult to engage. That wiggly dog really helped out. And then I also worked with another puppy because of Johnny's age. I knew he was getting older and would need to retire at some point. So we got a puppy specifically for this. He worked with me for a year. Ultimately, he wasn't the best suited for that work. He wasn't enjoying it as much, but his name was Bodhi. But I developed so many activities with Bodhi because he was really driven to learn tricks and perform tasks for kids. And so for that really active involvement as opposed to Delta's more, just supportive presence. And then now I'm working with my mom's dog, actually, Sky, who's another little Brittany Spaniel, and she's another real high energy little one. So she comes with me 1 day a week, and Delta comes with me 2 days a week. And that seems to be working pretty well in terms of the amount of time that they're working, because this is very tiring for the dogs. You have to keep in mind that normally they're sleeping during the day, and here they are, at work, seeing kid after kid, and each kid is different. They're having to adjust what they're doing and kind of, anticipate what we need them to do. And so it does get very exhausting to them pretty quickly.
Wow. Wow. This is a lot more detailed than I thought it would be. So am I picking up that you kind of want to match the personality and the characteristics of the dog with the characteristics and needs and the components as to what would work for that
Yes.
particular child? You kind of need to do a mix and match. So like you need at least maybe 2 or 3 dogs.
Well, not
or
necessarily.
you just
No,
decide
I
to,
definitely.
hey, if you have this one kid that comes in and you say, oh, that's not gonna work with this dog, you just don't use the dog.
Well, yeah, so there's
You
kind
know
of
what I'm
2
saying?
components to that. So just the reality of scheduling, I can't, say for sure that the kids that are going to do best with Delta come on days that I bring Delta. So I alternate which days I bring them. So all of my
Okay.
kids know both of my dogs. But there are
Okay.
certainly some kids that I will incorporate one dog more than the other with. So, there are days where, with certain kids, Delta's just taking a rest. And then, on days that Sky's there, she's just going the whole time. We might pull out the tunnels and have her running through the tunnels for some turn taking and things like that. I think all of my kids that are really interested in the dogs, they like both the dogs, but they do tend to gravitate more one towards one than the other. And it's just a mix. It's really interesting to see, which dog they, kind of start to mention is their favorite. But there is another component too, and that is if you either don't have a therapy dog yourself, or you have a child that, or I'm sorry, a client, because this is for adults too. I just happen to work with kids that maybe has a particular need. There is also something called the diamond model. So what I do is called the triangle model. I am working as the handler of the dog and the therapist. So it's dog, the handler / therapist, and the child. 3 components in the room. But there's also the diamond model where you're being the therapist to the child and you have a volunteer therapy dog handler team come in through organizations like Pet Partners or the Alliance of Therapy Dogs are 2 big ones. There's some smaller organizations as well that will provide that service as well. So you might have a specific need and work with that organization to find a volunteer that's a good fit for you. I haven't done that particular model myself, so I don't have a lot of experience with it, but I know some speech therapists and just therapists in general do that. And the thing that really appeals to me about that at some point I would love to try is you might be able to find, like if you had a child that was really interested in birds. I have a child right now who's autistic and just loves raptors in particular. So potentially I could find somebody who is partnering with like a parrot, because birds are one species that is considered a therapy animal or eligible for testing to be a therapy animal.
Yeah,
So,
I was
how
wondering.
cool
Yeah.
would it be to, to have that volunteer come in? It's a whole another layer of complexity in that you're planning things out in advance with a volunteer. It's a whole nother ballgame, but it is a possibility.
Okay. 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 Let's get back to the dog. And
Mhm.
let's say that this is something that I wanted to do. What do I have to do with the dog prior to even like, do I take 6 months to a year to do some specific training? Or
Absolutely.
what needs to be done? Or I can't just say, come on in, Delta, you know, meet Suzy
Right.
Q, you know, you're
Um,
the new
so
therapy
it's
member. You have to prepare, right?
absolutely, yeah. So
Okay.
there's definitely a very high barrier to entry in this. It's not the sort of thing where you can take a weekend course and then on Monday morning, be implementing it directly into your session. So you
Okay.
definitely, if you're using or partnering with your own dog in particular, you definitely need to make sure it's an animal that you have a really strong bond with. So the organizations that provide certifications and registrations in this recommend that you have that dog for at least a year. And the same with the dog's age too, like a really young puppy, it could be overwhelming with. So there might be ways to incorporate your younger dog in very small increments, but probably not coming for an 8, 9, 10-hour day. That would be too much for a
Yeah.
very young
Yeah.
dog.
Oh, yeah.
So yeah, typically 6 months to a year would be a very reasonable expectation for how long before you're incorporating them on a regular basis. But
Okay.
definitely doing a lot of training, doing some basic obedience training. Your dog does need to have basic manners. I will say my little Sky, she is still really bad about jumping up on people. Most of my clients fortunately enjoy that and aren't, offended by that or shocked by that. But, ideally having a dog that's, not going to jump up on people and things like that and can walk on a loose leash and have, you need to be able to be in control of your dog's body to give the client space or come closer, things like that. The path that I took was I started out with the Canine Good Citizen testing, which is through the American Kennel Club, but it's open to anybody. You don't have to have a purebred dog. Some of the therapy dog organizations do require that as a prerequisite as well. It just looks
What
at
was that
general
again?
manners.
Canine what?
The Canine Good Citizen, or sometimes it's abbreviated as CGC.
Citizen.
Mm-hmm. And so it
Oh,
just looks at, I think it's 10 skills that are just basically manners, looking at how your dog is able to approach a stranger or have a stranger approach them. It makes sure that your dog is relatively safe. And I always like to say there's no such thing as a 100% safe dog. A big part of our role as their handlers is really reading their body language, making sure they're comfortable. And then again, monitoring those things, like making sure they have rest breaks throughout the day and that we're not overworking them because if the dog's uncomfortable or overworked, that's when you're most likely to have a safety situation. So the
okay.
canine test looks at just kind of that basic suitability for the work. And then from there, you may choose to go on to one of those volunteer organizations that I mentioned, like Pet Partners or the Alliance of Therapy Dogs. I did not go that route for a couple of reasons. But now, just a few years ago, the Association of Animal Assisted Intervention Professionals, or Triple, they are a newer organization. And they are starting this year, they are doing third-party evaluations of therapy dog handler teams. So I actually participated in the pilot study for that or the pilot program while they were standardizing the testing. And what I did was I hired a dog trainer, a local dog trainer, to come in, and she had a checklist of behaviors that she needed to see or not see, as the case may be, certain behaviors that they don't want your dog showing. And I set up a couple of mock sessions I had real kids come in. I wasn't billing for that time. We weren't, necessarily working towards their goals, but we were going through the paces of an actual therapy session and how I incorporated the dog. And that trainer was able to see, that my dog was safe, that she was predictable, that, she would reliably respond to what I was asking her to do. And through that, then I was able to get a special liability insurance policy. So through
Hmm.
that, getting that third-party evaluation testing, because that's the number one question I get is how do I get professional liability to cover this? And prior to this CCC-AAIS testing, it was kind of iffy. My liability insurance carrier said, yeah, it's probably not a problem, but they didn't have specific wording about having dogs in the office or animals in the office. And so it was a little bit, it felt a little bit risky, even though I had done my due diligence to make sure that it wasn't something that was disallowed. They just, if something had happened, I'm not sure how much I trusted that. But now we have, because of this CCC-AAIS evaluation, having passed that, we have a whole special policy, and it's actually surprisingly affordable just to cover if something happens, not only if the therapy dog were to do something to a client, but also if she gets hurt on the job too, because we do have impulsive kids. And so it covers veterinary care and things like that if she gets hurt on the job.
Okay. Wow. Wow. Okay. Okay. This is great. This is great. So, I mean, there's a lot to it. So I am
Yes,
assuming that there are a lot of benefits to it as well, because you're not going to go
absolutely.
through all of this unless it's really going to be effective and efficient in your therapy. So, what are some of the benefits?
Yeah, so the one that I capitalize on the most on just a daily basis is that sensory regulation. So my dogs, I've trained them to provide deep pressure input. So the kids will lie on their stomach typically, or occasionally I'll have the dogs lie on the kid's lap. I like to have the dogs lie on the kid's back just because when the dog's across the child's lap, I find a lot of the kids want to like lean in for a hug and they might kind of impulsively grab, and I don't want my dogs to feel trapped. So the kids lie on their stomach, and then I either have the dogs lie on top of them, or sometimes we'll put like a mat. I've got like a big blue safety mat, and the dogs will lay on top of that to give even more pressure. We call those heavy squishes, and get that deep pressure input to the kids' bodies. And then
Hmm.
also I'll have the kids do like some slow, calm breathing with them. So we'll put our hands on the dogs, and I do, I would say, shoulders to tail. So we put our hands on the dog's shoulders and then slowly go down their back to their tail, doing our breaths to get that back to calm if I'm seeing that they're starting to become anxious or dysregulated. And then, like I mentioned, on the flip side, that more alerting piece too, when I have kids that are, more difficult to engage, or maybe they fell asleep in the car on the way there and they're not fully awake, we'll pull out the tunnel, take turns running through the tunnel with the dog. Enjoys getting on the swing that I have here. So I do have to, hold it and make sure it's moving very slow and carefully for her. But the kids, that just brightens them up and gets them so alert and ready to go for work. And then another big piece is transitions. I would say probably half the kids that it's not so much typically transitioning in because they know that I have a ball pit and swings that I'm really fun and stuff, but often they don't want to leave. And so that's when we start to see some of those kind of temper tantrums starting, or just a lot of stall tactics. So I can just say, oh, Delta needs to go potty. Can you help me get her leash? And we'll put her leash on, and then they're ready instantly and it just really helps them move efficiently out of the space.
Yeah. Yeah. Wow. Okay. Well, let's go through some of those. And especially like with the first one, with the more sensory integrative piece with the deep pressure. And I'm very familiar with the vest, the deep pressure vest.
Yeah.
But okay. So do you have the child? Okay, why would you do that first of all with the dog? And like how long? And is that something that you would have the child talking during that time? Or is this to calm the child down, strictly for calming? And is the child on the floor? Is the child on a cot? Give me some details about that. I'm having a hard time visualizing that.
Okay, yeah. And on my website too, I have some pictures of this as well, because it is something that I have just found so helpful. So the kids are, willing participants. I'm always, watching their body language or, listening to their words, but I often will show them a picture or a little video of Delta with another client performing this, or whichever dog I use. Delta is heavier, and so most of my kids actually prefer that they get the squishes from her on the days that she's here. But yeah, I have them lay on their stomach, and then I just lure. I have a treat in my hand to lure Delta to stand over them, and then typically I ask them to tell her to squish. So if we're working on articulation, we can use that word squish, like for S or the K or that SH at the end of the word. I can adjust that word if there's a different target that I'm working on that day. If I have a child with, language or maybe some social communication piece, we might be working on asking, kind of polite questions like, will you give me a squish? Or can I have a squish? And then as soon as they say that, I just cue her to lay down, and she lays pretty gently. I will say Bodhi, the year that I had my younger dog coming with me, he just kind of flopped on the kids. And so I had to be a little more discerning. Some kids appreciated that, and some kids that was too much. So, you're always watching each individual reaction. And then the other piece is I always make sure the kid knows in advance that they can say, typically the term I use is that's enough. So that's their cue that, they're done. But I'm also watching the child's body languages as well, too. If they're feeling uncomfortable in any way, the dogs are trained. And that's a big piece of it, is it does take training. It looks very simple when you see a video of it, but it certainly was very odd for all of my dogs, to be laying on top of somebody. They were very hesitant about that. And Sky in particular, because I had worked so much, my little Brittany Spaniel that I'm working with now, I'd worked so hard to have her not jumping up on people. And then you could just see the wheels turning, like, wait, now you're telling me to get on this person? Wait a minute. But so sometimes it's just a matter of a few seconds, and we might do it over and over again. For example, this morning, he's actually high school age with autism with very high support needs. And he loves this. And this has become a transition routine for us as well. We come in and wash our hands, and then we get squishes from Delta. So he's kind of got that script if he knows what's coming up and he knows how to ask for squishes. And he will do it, 10, 15 times in a row. Often I'm like, okay, now we need to move on to something else. But I'm if he needs it for regulation, then we can do more. I have had one of my reading clients actually had come in one time and he just came in a bad mood. And he told me that. He's like, I've had a really hard day. I don't want to be here. So we did the heavy squish where he was actually in between layers of a mat, and then Delta was laying with her whole body on top of the mat. and he loved it. And they sat there for 20 minutes. And I'm watching Delta. I'm watching him, his body language. I had him with a slant board in front of him, so he was doing his writing, and we were doing our work. And Delta was there the whole time, and I was just every few seconds giving her a little, or every few minutes, I mean, giving her a little treat to reward her. And she was completely relaxed. She'd shifted her hips over. She was enjoying it. He was enjoying it. The only thing was, he finally at the end, he was like, I think that's enough. And when he got out, he's like, I'm so hot. And I didn't realize like how sweaty he'd gotten. But
Yeah.
yeah, so it can be just
Oh
a few
my
seconds, or it
gosh.
can be a longer period of time.
Isn't that
And then
amazing?
likewise too, like I have a middle school girl who can be very shut down. She's more of an internalizer. And Delta often, like I said, will lean against her. And I have definitely noticed if she's having a hard day, and Delta's like maybe laying on her bed, if I, invite Delta over and ask her to come over, and she'll put her head on this girl's lap, or, kind of lean against the girl, she just starts talking so much more. She kind of comes out of her shell. And so I think, again, how much of that is psychological and how much of it is just that sensory, feeling more grounded in her body. It's a little bit hard to say, but it for this particular child makes a huge difference.
Oh, I love it. I absolutely love it. Wow. Okay, what were some of the other things that you talked about? I kind of got stuck on the
Oh,
sensory piece.
transitions. Yeah. So like I've got a little preschooler who I have a hand washing routine at the start of my sessions. I find that just important. And so often he, doesn't want to do that. And so Delta will come and stand on the stool. I haven't taught Sky that yet. She's been a little resistant to that, but she'll come up and stand on the footstool, and then he thinks that's hilarious. So he'll follow her in, and then, half the battle's done just being in the room with the sink. But another piece
Yeah.
that I didn't mention too was just incorporating words to talk to the dog. So giving the dog commands, or even I have these puzzles where you hide the treat in, under little pegs and things. I have a handful of these different dog puzzles, and I found all sorts of uses for them. But I have like kids working on those beelers, those g sounds, and doing that g to d in good and dog. It's such good, that tongue moving back and forth, back and forth. So, we'll hide the pieces in the puzzle. And then each time the dog, picks up a peg and finds the treat, we kind of pause with the puzzle for a second, and we tell the dog, good dog, or good job too, for the j sound. I've just over the years found all sorts of different words that I can incorporate that have different articulation targets in them as well. And that motivation, it's just so much more motivating to have that response from the dog, as opposed to, let's do some more cards, or, let's do, some of my kids are really into books, but I think that live animal component is huge, hugely
Yeah.
motivating.
Yeah, I think so too. I mean, the live animal component. Yeah, you
Mm-hmm.
said it right there. Because the closest thing that I have come to, this type of therapy would be bringing a puppet in,
Mm-hmm.
and I loved doing that because that was a third therapy member, and
Yes.
it seems like I always got more interaction, more words, longer sentences, a happier time when the puppet was in there and the child was interacting with the puppet.
Yeah.
And I could see that, you know, exponentially a bigger help, with a dog, with a live animal. And we could
Mm-hmm.
get into other types of animals that you could bring in, but especially the dogs.
Yeah.
And okay, so the behaviors, list for me some of those behaviors. I'm hearing you say, yes, the sensory component, the deep pressures and so on, that helps to sort of regulate their behaviors, calm them
Calming
down,
breaths. Mm-hmm.
the interaction with them.
Mm-hmm.
What other things could we like list if I was taking
Yeah.
notes?
Yeah. Another piece is, like you mentioned with the puppets too, having kind of that third party. So I call it a neutral third party. So if I'm having a child that doesn't, want to participate in an activity that I have planned out, the child and I can be a team, and we're either doing something for the dog or teaching something to the dog. And one thing that I found really interesting is, even if my dog's asleep, which quite often, they are when this is happening, because, they're not really actively participating, they're just resting. The kids, even kids that are older and, cognitively, within normal limits and things, they totally buy into, even though her eyes are closed, she's listening. I'll tell them
Yeah.
that, and they don't question it. I think it's kind of that that desire to believe that she's really playing. So I'll have kids like teach the dog the steps to a game or the steps to building something. The child and I can work together to do something. Or also like just that care piece too. I have a little girl, she was only 2, which is something I want to mention too, kind of that early intervention and kind of special populations that we might be working with as well. But we have, some very script-based therapy around when she comes in to wash her hands, she also wants to fill the dog bowl. And so we've over, a few months here just built up the number of single words, and now she's up to some short phrases, all the different steps to washing the dog's bowl. She likes to wash it out first, and then we decide hot water or cold water, and just slowly built up that script over time to where it's been really effective at giving her a very meaningful way for using those first words and early phrases.
I love it. Yeah, that makes all kinds of sense to me. Wow. Wow. Got any more benefits that off the top of
Yeah.
your head? What else? 'Cause I love this.
Yeah, I'm looking at my notes here to see if there's something else. The non-judgmental listening is a really big piece too. And I think that is probably more commonly known about with like the reading therapy dogs, the dogs that go into schools and libraries and things like that. And kids can just sit there or lie with the dog and read to them. And there's no specific expectation on the dog's part. They're just, staying there listening. But the research often shows that kids will persist for longer, that, they'll read longer or they'll try harder when there's an animal there to read to as opposed to another adult. And the theory is that, they know that dog's not judging them. The dog is just happy to be with them. They're not going to be, jumping in and correcting them all the time. So I do work quite a bit with kids with dyslexia. I love doing the literacy piece of that, the decoding piece in particular. And so I'll quite often have the dogs be, a listener for the kids. So we'll practice at the table, going through, make sure we can decode all the words, looking at, the punctuation for fluency piece. And then it's like, well, let's go read it one more time. So we get those repeated readings, which is so important, that repeated practice, but it gives it again meaning. It's like, if I'm like, I've already heard it, I myself have already heard the child read 2 times. If I said, okay, well, read it to me one more time, they're kind of like, oh, I've already done this. But it's like, okay, now let's go over to where Delta's resting and we're going to read it to her. It's, it's like starting fresh again. It's a whole new reason. And then, reducing power struggles. We've talked a little bit about that. Even I find just having the dog in the room gives me time sometimes to distract the child if they're starting to have some escalating anxiety or escalating resistance. The child that I first started bringing Delta with in particular, his ears would start to turn bright red, and I would kind of notice him start to hold his breath when he was starting to get worked up about something. And so over time, I got to where I would notice that, and I could be like, oh, I hear Delta snoring, and just completely shift his thoughts. Or, one time she had some gas and, she let it fly pretty loudly. And, it just, he was getting to that point where he was real upset. And then, we were laughing, we had that moment of potty humor and just that laughter and break, it's like, okay. And it gives me a chance as a therapist too, to kind of regroup for a second. If things aren't going the way I, had planned out or had foreseen for the session, we can just kind of stop and talk about the dog for a second, building that rapport, maintaining that rapport with kids where it's easily lost.
Yeah. Yeah. Oh, these are all great. Yeah, this makes total sense. I love this. So, I mean, it's still new, obviously, but I know that there has been some research. I don't know if there's been too much in the field of speech language pathology, but therapy, certainly there's been research. Where are we right now as far as the research, the incorporating dogs into meaningful therapeutic situations? Where are we right now, and where do you think it's going to go, and how are we going to get there?
Yes. So like you said, most of the research right now is more in the fields, the mental health fields in particular, but also somewhat occupational therapy and physical therapy as well. And most of the research that I've seen, and I did have to look at it quite a bit when I was writing the Pause for Progress book, but I haven't personally seen much research working with therapy animals with kids. It seems to be mostly in adult rehab. But we do have one really important study that came out in 2022 from Cheryl and Hengst. And so they looked at bringing a therapy dog into sessions with adults who were recovering from a stroke. And they were looking at a couple of things. One is how feasible was it for a speech therapist to be able to incorporate an animal? And then secondly, what effect did it make? They were looking at what they call rich communicative environments or rich communicative contexts. I forget exactly the phrase that they use. But what they found was that kind of across the board, the patients that were coming into these therapy sessions had more initiation of utterances, and they were using a variety of modalities to communicate. I imagine it was kind of like your kind of typical stroke group sort of thing, but more utterances, more playful language. They looked at types of language that were initiated by these stroke patients, more playful language. They changed register to talk for the dog, which I found really interesting. I wouldn't have even thought to look at that as a study person myself. And then it's actually a really fun study to look at because at the end they have a story of one particular man that they named Rick in that. And he was one that was very resistant to coming to therapy. And I talked about how much more he talked. And at the end, he said something like, I'm only coming back if the dog's here, sort of thing. So when we're looking at getting attended, obviously if clients aren't showing up, we can't do anything for them. So if they're motivated to come, to meet the dog and see the dog and have that bond over time with the animal, then, it gives us more opportunities to do what we need to do towards working towards goals too. And then the other piece of that, the research, the Cheryl and Hengst article too, was that the speech therapist, so that was incorporating the diamond model. So they had a volunteer therapy dog handler team coming into the sessions. And they found that it just took like a couple of sessions for the therapist to feel comfortable with that. So it was something that, there was a lot of concern about product with planning, sessions, bringing in a different way of running these sessions. But the therapist found that pretty quickly they were able to figure out ways to incorporate the therapy animal and their handler into the sessions and find it beneficial. So that's the best in terms of speech therapy in particular. But we are getting more and more research. Again, this is becoming, animal-assisted interventions in general are becoming more widely known and more widely accepted kind of across fields. And so there is a lot of research that's in progress. We just like last week or maybe 2 weeks ago had some research come out of the Mayo Clinic looking at the welfare of the therapy dogs. And they found, just a second here. They found that, again, it was an adult stroke group, but they found that the dogs were actually as calm or calmer at the end of the session than when they started. So the dogs themselves are enjoying it, or at least it's not detrimental to them. And these were experienced therapy dogs, and they were, coming in with a handler, a volunteer handler. So it wasn't exactly the same situation as what I'm doing with my dogs, but it's at least a start, because we do want to make sure that we're not, causing harm or undue stress to animals. I know my dogs love it though. All 4 dogs that I've partnered with, they know where I keep their vests in the closet, and, I open that closet door and they just come running. And when I had 3 of them that I was alternating who I brought, they would like push amongst each other and compete for who's going to get their vest on that day.
So they know that's their cue. Yeah.
I will say, I think studying animal-assisted interventions is quite difficult because there's a lot of variabilities. So, again, some kids or some clients, respond better to one animal than another. There's also just that variability over time. The child that I started bringing Delta for in particular, that first couple of years that I was working with Delta, she was vital to my sessions. I would not have wanted to, have a day where she wasn't there. But then over time, he didn't depend on her as much. I had bridged that gap with him to where he had a positive association coming, and we had built that rapport to where, there were sessions towards the end before he graduated out, before he was discharged, where, Delta was pretty much asleep the whole time, and he was fine with that. And again, he was never an easy child to work with, but, had just gotten to the point where we weren't as dependent on that. And then likewise, I've had several kids that initially either weren't that interested in the dog or maybe had a little bit of anxiety. A lot of my kids with autism in particular have that approach avoidance where they're very interested, they want to interact with the dog, but then it's a little bit too overwhelming. So I have, quite a bit, and I have some more on my website as well on, handling that situation. But some of my kids, it takes a few months, or, I have one kid that's been coming for a whole year, and just right before Christmas break, he just never had any interest in the dog. So the dogs rested while he was there, and that was great. But I just noticed he was a middle schooler with autism and, uses a variety of communication modalities, but pretty minimal verbal language or spoken language. And I just noticed he was watching Sky and kind of like giggling to himself. So I called Sky over and he fed her treats for the first time and was petting her and was, was like he noticed her for the first time. It was really interesting. So I
Wow.
don't know. That was right before Christmas break. So I don't know how much of a role the dogs will play in his therapy. It might be something that he's interested in having them more actively involved in his sessions, or it might have just been a one-day thing. But there's, when it comes to studying, I think so many research studies are like 6 weeks or 8 weeks. And it can be really hard when you're bringing in a therapy animal because there's such variability over there.
Yeah, yeah. I do have a couple of remarks here, and please write the research names in the chat. And
Okay.
I need to mention though that I sent a one pager of all of your research articles that you listed, the bibliography.
Mhm.
And so it should be on the speechtherapypd.com website where
Okay.
they
I can
signed
always
up
type
for
it into
the
the chat when we're done too.
and I've got it here too. I mean, I can copy it and put it in there quickly. But
Okay.
there is a page out there. Also, Charlotte, you sent me another very recent article, and
Mhm.
it is not on that list. So we want to be sure and give people that one because it just came out like in this
Okay.
last couple of
That
weeks. But I will copy and paste that in here. And I see here where somebody said I never saw handouts there. Well, it's supposed to be there, but I'll put them here as we go
I'm
along.
typing in right now,
Yeah,
just that new one on super long name from
just
the
check that
Mayo
it's
Clinic
not
on
there.
the therapy animal welfare.
Yeah, it needs to be there. Okay, let's see. Okay. Also, the other question, and I don't know if you want to address this now, Charlotte, but I think it's kind of an interesting one. I have a question if time permits. She says, Charlotte, do you have any experience with equine assisted therapy?
I don't
Yeah.
personally, so I am an equestrian. Equestrian sports is my biggest passion. And so I have two horses. And someday I would love to incorporate them. I kind of envision, I live in kind of a semi-rural area and I'm always looking when something comes up for sale in the area to where it would be, a quick walk, to walk my horse there, a way to somehow incorporate my practice, get a house to practice out of and have, a field there where I could have my horse. But I know there are speech therapists and therapists just in general, rehab therapists that do incorporate, there's both therapeutic writing, which looks at teaching specifically writing skills to people with disabilities. And then there's also hippotherapy, which is
Mm-hmm.
more specific to it. The child isn't necessarily there to learn how to ride, but you're addressing whatever motor needs or speech needs that they need or psychological needs too. The mental health field has horses that they partner with quite a bit for different things because horses are so sensitive to human moods and body language. So it can be a great way to tie into that. So I
Yes.
believe the best source for information on horses would be PATH, and I don't remember exactly what that stands for, but it's just PATH, all capital letters. They have a lot of information on their website about partnering with therapy horses. I do have a kind of an online friend too, a social media friend who has a miniature horse that she uses similar, I think, to how I incorporate the dogs. She has dogs as well, but the horses carry like the AAC device for the child. They can attach the AAC device onto the saddle and things like that to get more engagement.
Okay. Okay. Well, I am trying to paste this in. It will not take it.
And I typed in that new one on the animal welfare too. I'm not sure how you pronounce it. It's a
That's the
lot of
new
different
one. I
authors.
know it's SHIH and there's
Yeah.
about 10 authors there, but yeah, there's that new one. And then the references has 1, 2, 3, 4, 5 on there. Yeah, it won't go in. Let's see here. I'll keep working on it. But I did send it to speechtherapypd.com, so it should be there. I will contact my contact there and make sure that it makes it because I don't think it'll take all of this. Let me copy and paste one more time to see to everyone. Type message here.
And
Paste.
I'll
Nope,
also type into the
won't do
chat
it.
that there's a great book, the Handbook of Animal Assisted Therapy, the 6th edition just came out, and it's not so much a how-to manual. It gives you some ideas of how to get started, but it really summarizes the research in all the different aspects. So that's the Handbook of Animal Assisted Therapy, and the editor is Audrey Fine.
Okay. I don't see that on the list of references. So,
no,
but you
I just
have it
typed it
here.
into the chat.
You just
but
typed it
if
in.
somebody,
I gotcha.
Yeah, but if someone is specifically needing research, I know if you're having to kind of justify to an employer or to a school district, for example, that's a great resource for finding different studies that you might need to back up what you want to do.
Okay. Okay. Well, I will work on getting that listing, the reference list to Speech Therapy PD again, and make sure that they put it up. I'll contact them right when we're done here. At any rate, okay, girl, let's see. We've done the benefits. Are there any glaring or anything specific that we need to know as far as maybe barriers or risks or negatives to using a therapy dog, or cautions that we just, that we need to know?
Yeah, so there is always risk. Dogs can bite, and especially working with children who are kind of right at the dog's level, it's definitely important to do that third-party evaluation, because it is really easy for us to be in love with our dogs and want to see the best in them, or whichever species you're partnering with, and maybe miss some of those cues that the dog isn't the best suited. So we're really looking for that affiliative behavior, which just means the dog wants to interact with people. This isn't a dog that's just tolerating it, because they might tolerate it for a while and then have a day where they're, done. So you want an animal with affiliative behavior. As a handler, you need to get really good at reading your dog's body language so that you're looking for that active consent. The dog, again, isn't just tolerating it. The dog is initiating interactions, or, saying, yes, I want more. And another piece is resilience too. One of the big challenges, especially the caseload that I work with, is, kids can be very impulsive. They can have short attention spans. A lot of our kids have some receptive language difficulties, where either attention-wise or receptive language-wise, they have difficulty following directions. So I'm always teaching and reinforcing, how my dog likes to be petted, that shoulders to tail idea, that they're not going right for the dog's head or getting right in their face. But, there are times where kids are going to act impulsively. So having a dog that's resilient and able to bounce back from those moments and, not get unduly stressed by them is really important. So it's definitely not something that just any dog can do. You need to really honestly assess the situation. And like I said, I had my dog Bodhi, who, we got specifically with the intent that he would become a therapy dog. And he did great for a while, but, over time, it was just becoming clear it wasn't going to be ideal for him. And so anytime a dog's not enjoying it, we increase the risk. I did want to mention early intervention too, because I have seen on some websites where they'll say that animal assisted therapy is, for children over the age of 5 or some arbitrary number. I've never seen any research or any formal reason that age is given. And I know I certainly have kids who are chronologically older, but still act very impulsively, like a much younger child. And I have very successfully integrated the dogs into some work with, 2 and 3-year-olds for sure. In those cases in particular, I'm making sure that the child is, familiar with dogs. The 2-year-old that I mentioned that really loves to help me with the water bowl, as, that script-based therapy, she has 2 large dogs herself at home. So it's not something unfamiliar that she's coming into. But then I am also, more vigilant. And that is a big piece of animal assisted therapy as the handler, is that kind of vigilance that you have to have. It can be very exhausting. You're really increasing your cognitive load of focusing on doing the therapy, but also watching your dog and making sure that all those interactions are taking place safely. And one of the terms that we use a lot is mutually enjoyable. This should be something that everybody involved is enjoying. And if not, then, then we need to reconsider, does the dog need to go take a break on their bed? In my case, in my office, I have a smaller kind of interior office where my computer is. And if she really needs a deeper rest, or the child, is maybe showing some fearful behavior or something like that, I can separate her out with a closed door, and she can just, have a rest, or, have a chew toy to chew on for a while. And then another piece too that I forgot to mention when you asked, how does one get started in this, is getting that informed consent from clients or their caregivers. So making sure that there's no fears. If there is some hesitation around dogs, that's certainly something I found that you can work around. Again, that approach avoidance. A lot of my kids, especially with some sensory processing differences, might be really interested, but the dog's, whiskers tickle them, or, just the movement is too fast. So you can kind of very gradually, step by step desensitize them to that. And I've kind of gotten that down to a science with my kids. But, it is important to make sure that the child is feeling safe and comfortable. The vast majority of kids I've had have really loved having the dogs here. Again, I have a few that don't really show preference one way or the other. And so that's fine. The dogs can just rest. But if I had a child that really didn't want the dogs around, it would be best to refer to another provider in the area. That would just not be a good fit.
Right.
And also medically fragile.
Yes.
Fragile too. So dogs can carry some zoonoses, some diseases. It's in terms of risk, it's pretty minimal overall, especially like I said, I incorporate hand washing into my sessions, but hand washing or hand sanitizer is, definitely recommended. I find my dogs don't like the smell of the hand sanitizer. And so they'll back off a little bit if kids choose to use hand sanitizer. So I encourage washing at the sink, but washing hands afterwards, or encouraging the family to stop by the bathroom and wash hands afterwards. But if you were working with a really medical fragile community, again, it might not be the best fit for you. You'd have to really take into consideration, the risks, and make sure that the client and their caregivers really knew the risks involved as well.
Mm-hmm, mm-hmm. I'm thinking about the transfer piece. Maybe the family of a child that you're seeing has a dog, or maybe they don't, and I don't know if that impacts how they do in your therapy sessions. But I'm wondering if there's interaction between you and the dog and the child, does that carry over, with the home environment, if they have dogs or pets at home? I mean, do the parents ever comment about that?
Yes, so I definitely have some kids that they will take that as a generalization or a homework activity home. So if we're working on like S clusters, for example, is a real common target for my kids.
Mm-hmm.
And so we'll practice here with, one of the dogs. Sky's name is really perfect. That's combination. So we'll say, Sky step, they step up on different pieces of furniture, or spin is a really popular one, or what's another one? I can't think of it, but I've got a handful of different like S cluster commands that they can give. And then we'll talk with the parents at the end. Often what I'll do for just a little like quick generalization is they've practiced it with the dogs, and then we'll go out and the child will teach their caregiver what words they have to say to the dog to make it do those same behaviors.
There you go.
And then we'll talk about like, is this something that their dog at home can do? And I always double check with families if I'm not that familiar with the situation, to make sure that their family dog is comfortable with their child, because, not all dogs are. I think the biggest challenge I have is that kids come in and they're so used to their own dog who lets them do anything. And so teaching that dog etiquette with my therapy dogs is really important. We're not going to, just flop on the dog or, things like that, especially for some of my more black and white, thinkers. It can be really important to have some really strict rules around, this is where we pet the dogs. This is how we feed them a treat. I have kind of 3 different ways I teach how to feed a treat to a dog. They can either toss it if they're not comfortable with the dog coming close, or they can put their hand underneath mine and I feed the dog the treat, or they can put the treat in their palm of their hand. I call it the hand plate to treat that dog. And those are kind of like, or put it in a bowl and then we present the bowl to the dog. That is another option as well. So I guess 4 ways, but because a lot of kids want to just, hold it in their hand, hold it in their fingers and feed it. And that's, more likely to invite a nip, especially if they jerk back at the last second. So that's one of the biggest challenges. Just kids come in used to being able to do whatever they want with their own companion dog. And it's like, if you don't have that same relationship with my dog, and my dogs are, dealing with this all day long. So we want to make sure that the therapy dogs are being treated in a very respectful, positive manner.
Yes, yes. So do you have parents in your therapy sessions as well, or no?
Sometimes. So in my waiting room, the parents can see most of the therapy room. So some parents will choose to sit out there, and some parents come in with their children. It really depends on, the dynamics involved and whether the parent just needs a quick break or not. But yeah, they come in as well.
Okay. Okay, great. Well, we have a nice comment here. It says, I used my personal dog after she was evaluated by a local trainer several years ago in private practice. And the parents of the children really enjoyed the relaxing and
Mhm.
calming benefits of petting the dog during, or the patients, I'm sorry, petting the dog during sessions. So we have
Absolutely.
somebody here that's has done this. So that's
Yeah.
great. Great.
And I have talked with other speech therapists too. I know when I was first researching for the book, I reached out to, the few SLPs that I could find online just through Googling that were doing animal assisted therapy or mentioned having therapy animals on their websites. And I know a couple of them just mentioned in their description, their dogs are just what they called greeters. Like, the kids come into the office or, if it's a home-based setting, and just having the dog there again just starts the session off on the right foot. And they weren't necessarily actively involving the dogs in the sessions otherwise, but just having that greeting component was enough to see some benefits in the clients. But you mentioned caregivers too, and I do certainly have parents who come in and they love getting to see the dog. And I found it can be a nice way to kind of break the ice with new parents too, because we can, I don't have children myself, but in some ways having dogs can kind of be like parenting dogs as well. And so we can kind of commiserate on things that we have in common in that regard as well.
Oh, we have another comment here. I love this. My clinic has a trained canine companion dog 2 days a week, and our entire team is benefiting from his presence. We use dog hugs
Oh,
as a coping mechanism. I love that. And then here's another, I think this is a question. Which other animals may be useful in therapy?
yes, I have the list here because I can never remember them all off the top of my list. So these are species that are currently eligible for third-party testing through pet partners, or I'm not sure if all of them will be eligible through the CCC-AAIS testing that I participated in the pilot program on or not. But these species are chosen because they're animals that we know enough about their body language to be able to judge if they're enjoying the interactions or not. Because again, we want the welfare piece. We want it to be mutually enjoyable for them. And these are also species that have pretty low risk of that zoonosis or disease transmission. And so those are dogs, of course, cats, horses, llamas and alpacas, guinea pigs, domestic rats, birds, miniature pigs, and rabbits. And the domestic rats, I've heard some really fun stories from actually volunteer handler teams that have their domestic rats. And they find going into middle school with the boys, some of those boys that are like too cool to, want to participate. You bring in a rat and they just think that's the coolest thing because everybody else is grossed out by it and stuff like that. Or those kind of harder to reach adolescent boys might be a fun way.
Yeah,
I would
yeah,
love
the
to have a
boys.
therapy cat. I think it would be
Yeah,
so cool to have a therapy cat. And again, I really want to work with horses or, potentially a miniature horse in the future. But for right now,
yeah.
it's dogs
A
that I
little
partner
mini.
with.
Yeah,
Mhm.
yeah, great, great. Okay, we have a nice comment here. It says sounds like a very sounds like a very likely and helpful option to use in therapy. Thanks. All very helpful and interesting. And I
Yeah,
agree.
great.
And I agree. Yes, thank you
It's
so
one
much,
of those
Charlotte. I
Yeah,
appreciate
it's
it.
one of those things that's not for everybody, but if you're an animal lover, it can be such a great fit.
Oh yeah, yeah. And very inspiring. If I had a private practice now, I think I would do that. And the school thing, I think I would, maybe even investigate in that just to see. Because, it's so funny because, when we were talking about the school involvement and using dogs and so on, I remember, if you had a dog loose on the school grounds and stuff, all the
Mhm.
kids immediately stand up and go to
Oh,
the
yeah.
windows and see the dog that's running around the school. I mean,
Yeah.
it's like kids are just mesmerized. And maybe they
Yeah.
wanted to break, but I think, it's just it can be very inspirational and just a sweet thing, just in something
Yeah.
different. Yeah. So
Yeah.
I'm thrilled with this. I think it's a good idea. I hope people, do it. Oh, well, here's another.
Oh, I see some of
This
the
is,
chat, the
yes,
comments coming
an
up.
exciting discussion. Incorporating a therapy dog into speech sessions is a dream of mine. Ooh, and this podcast was a fantastic starting point. Thank you so much. Thank you. And this lady says, my personal dog loved to join virtual therapy sessions, all right,
Mhm.
during COVID, and the kids loved giving her commands with their speech targets. Oh,
Oh,
that's a
wow.
great
Yeah,
idea. How
that's
about that? We didn't
fantastic.
even,
Yeah.
yeah, I love that. And then also, I thought about their use in adult therapy or after stroke.
Hmm.
Perfect. Yeah.
Yeah.
Well, then, a couple of those research articles would be very helpful for you, Cynthia. Yeah.
Yeah.
Well,
And
I
again,
want to thank you. Yeah.
yeah, I was gonna say again, different dogs are going to be better suited to different populations. So like Sky, my little Brittany Spaniel that I partner with, she probably wouldn't be a good fit for an adult rehab just because she does still kind of tend to jump up on people. And with adults, if they've got on blood thinners or that thinner skin or
Yeah.
less balance, more balance
Huh.
issues, that might be not a good place for her. And like
Okay.
Delta with the schools, I think Delta would have a really hard time in the schools because there's so much more noise, so much more just going on, so much more activity. I think
Yeah.
that would be overwhelming for her, whereas Sky would probably really just love that. So it's all
Interesting.
those little things that have to fall into place to be perfect. But when it
Yeah.
fits, it really is great.
Yeah, very interesting. Very interesting. Thank you. Thank you. And in closing, I want to thank everybody that was here for being here and for tuning in and for continuing to get the word out about the SpeechLink podcast. And also, if you so desire, you can access the audio only version on most popular podcast apps. And thank you so much for your supportive comments and your good reviews on there as well. And Charlotte, thank you again for your contributions to our field, and to all of you. Thank you for all that you do for your therapy clients. See you soon. Bye-bye.
Bye.